what is sickle cell anemia and how does it affect MJ?
Sickle cell anemia is a blood disorder that is predominantly it predominantly affects African Americans and people of color, that I've been told and from what I've read. The definition of sickle cell anemia is where the red blood cells sickle in the body. Your heart produces blood consistently, and as a normal person, I guess you would say, we produce red blood cells that are oval shaped or round shaped. Children or adults that have sickle cell anemia, their blood, or trait, some of their blood cells sickle like a C shape, and can produce blockages in your veins that create pain crisis, which basically means that your blood is not flowing properly, so it creates problems in your body as far as pain crisis. It can produce strokes. It can produce organs shutting down, and ultimately, I guess, cause death.
So when you were pregnant, did you have any complications?
No
Really?
Complications at all. Now, I knew that I had sickle cell trait. I did not know that my husband had sickle cell trait also. And usually two people with trait more than likely produce a child that has sickle cell anemia. Or they could have the trait, or they could have nothing. It's 50% anemia, 25% trait, 25% nothing. No blood disorder. So when I was pregnant with MJ, no, I had no complications. He grew, he was almost 10 pounds. When I had him, he was 8 pounds, 5 ounces. The disease does not become apparent until after they're born.
Okay. So when he was born, what tests or observations did they do to diagnose him?
Okay, after a child is born, they now, in the past they didn't, they now automatically do a sickle cell test, especially with people of color. So when they did the test, well, I brought him home. They did the test in the hospital. I brought him home about 2 months later. It was roughly about 2 months. Anywhere between 2 to 4 months. I received a phone call from the sickle cell center, because apparently the doctors have to forward that over to the center here locally whenever they have found abnormalities in a child's blood. And then I was called to the sickle cell center here in Greensboro on Market Street, and then they told me at that time that I didn't receive that. I was kind of upset because I thought they would have told me in the hospital, but it's something that they pass on and then they call you and tell you, or they send a letter or something.
Wow.
Okay, so what changes did you have to make in your life to, cope with his disease?
I didn't cope with it at first. I even though he went through the blood test and everything, in my heart I didn't want to receive that, because I knew it was something that could be fatal. And so it took me a minute to grasp on to that fact, because I thought I had trait and didn't realize my husband had trait also. So I was like, no, that's not real, And then they forward you and your information over to a hematologist oncologist, and then you take the child to that doctor, and that doctor is what made me realize that he actually had a disease, because she was very stern and she was very direct, and she told me regardless of how I felt, my son had the disease, and that I needed to get over whatever anxiety I was feeling, and she would help him live longer.
You needed to hear that too. And
I needed to hear that.
Yeah, you did.
She basically, like I said, was cutthroat. As soon as I got there and she introduced herself, she was like, Miss Stokes, I'm gonna tell you right now, I'm not gonna hold any information back. I'm gonna tell you straightforward, your son has sickle cell anemia, period. And she said, either you can accept it or not, but if you want me to work with you, we'll help him live longer. So she said, I'm gonna give you a minute to absorb that. I'm gonna leave the room. I'm gonna give you a minute to absorb it, and then I'll come back in and we'll talk. So of course I cried for a good amount of time, and then when the doctor finally came back in, she said, now, okay, are you good? You know, I said, okay, I'm good. She said, well then let's talk, and I'll help you. I'll help you help him lead a healthy life. And technology has changed, so there's a lot more that we can do for them.
Right.
So.
Okay. So before you were pregnant, did you have any complications, any medical issues besides the trait?
Yes. Most of my life, I've had problems with my cycle, and I had a lot of fibroid tumors. I was told a long time ago that I would never have children, that if I did get pregnant, I wouldn't be able to carry them to full term. That's if I got pregnant at all, because my tubes were blocked.
Wow.
So I had to have reconstructive surgery, and I thought I was going to be able to get pregnant after that, and then they found out that my tubes were blocked. So I had MJ in vitro fertilization.
Wow.
I had him by in vitro. And he would have been a twin, but I wasn't able to carry both of them because I got pregnant with him at 42.
Wow, okay. That makes sense.
So at 42, I got pregnant with twins, but I lost one of the embryos, and then MJ survived. Wow. And right after that, I had to have a hysterectomy. So I was able to have the child that I wanted, but after that, my body was still carried a lot of scar tissue. And they said, well, you know, if you plan on getting pregnant again, you'll probably have to do in vitro again. But of course, me and my husband didn't want to keep going through that, because we went through 3 cycles to try to have them. So on the 3rd try, we had them. But as far as pregnancy, I think my body was ready for it, because I had no complications whatsoever. Even at my age, I didn't have any morning sickness. I didn't have it was none of that. So I carried him fine. That's why it was hard for me to believe when he was born that something was wrong.
All right. So what is his prognosis today? I remember you said that it's been years since he's had a blood episode. So what does that mean?
Okay, what that means is when we first found out, from he was age 4 months till he was 3, he was in the hospital a total of 5 times within that time span, 4 months through age 3. At age 3, he was in the hospital 3 times back to back. And that's when we booked, remember the severity of the situation. Well, during that 3rd time he was in the hospital, they introduced a drug called hydroxyurea. Hydroxyurea was created or was implemented at St. Jude's Hospital for children with cancer. And they found that in smaller doses, it helped people, I won't say just children, but people with sickle cell. And it puts their hemoglobin levels, which is your blood levels, at fetal hemoglobin, which is what you have inside of you while you're carrying the child, before sickle cells developed outside of the womb, basically. So they started him off with the hydroxyurea at age 3. Normally they would not start him off until age 5. But since he had so many crises, they said, well, are you willing to try this? Because it's experimental, basically. Yes, because he's going through pain, and I can't deal with my child, at 3 years old, going through pain. He was barely talking at that time. So we said, yeah, we don't have anything else to lose, along with the Lord, prayer and things like that. So we started him off with the hydroxyurea. That was 3, almost 4. Well, he's 8 now. He hasn't had a pain crisis since then. Wow. Since 3, almost 4. So that medicine, along with communion, along with prayer, along with diet, exercise, vitamins, has helped him continue to lead a productive life.
That's great.
So I don't know if I can necessarily give you advice on it. I don't have any kids, thankfully. And I don't have a sibling or a parent that has sickle cell. Kyla, my sister, has the trait. But
which means one of your parents have the trait.
Yeah.
Which one?
It's my father.
Your father. Okay. Because I got trait from my dad. Okay.
So do you have any advice for me though? Because I'm not sure if I have the trait. I do have to look into it. I know that my brother doesn't. My sister does. And I'm the one who doesn't know. So do you have any advice for me on when I should find out if I do have it, what should I do? Do you know anything?
Well, of course, I would say get tested. You can go to the sickle cell clinic. They'll draw your blood, or the next time you have your physical, ask them, if they draw your blood for cholesterol, blah, 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 if they can do a sickle cell test. Because you've been told that your dad was a carrier of the trait. You know that your sister is a carrier of the trait, and you just want to know if you're a carrier of trait. If one parent has trait, their offspring, either one would have it or not. You don't necessarily have to contract it just because you're that. But in most cases, if a parent has a trait, one of the children is going to have trait, most likely. If your mom and your dad had the trait, if they have more than one child, one of them might have sickle cell anemia. It's one of those catch-22 type things. You either have it or you don't. I would say definitely get so you know, because with trait, with me growing up, I was always susceptible to colds and flus. Like I would never just have a regular cold. It's either going to escalate, you know what I mean?
Yeah.
Whether it be bad head cold, flu symptoms, whatever the case may be. As far as advice for people that have anemia, I have been told that there are older people now, my age or younger, or really younger, that are going through so many pain episodes and pain crises because they're not familiar with this drug, hydroxyurea. Why they're not familiar, I'm not quite for sure. Because any sickle cell doctor usually brings that up.
Recommends it.
They're like, we have this new drug because MJ, he takes it orally in a liquid. But as he gets older, he'll be able to take a capsule. He'll be able to take it like pill or whatever. He may have to take this for the rest of his life. Our prayer is that they'll find a cure for it. Right now, I've been told the cure, one of the cures, I guess, for sickle cell is a stem cell transplant, or I think that's it, stem cell transplant, which is very, 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 very painful, very painful. And I don't know who would be able to give him, because if I have trait and his father has, we can't be the donors. You know what I mean? I don't know if they have a bank that supplies somebody that might be able to help them, but we're not going to go that extreme. I won't say never, but MJ's been doing very well on the medicine. I would suggest that anybody, if you're going through it, it's all going to depend on your environment, as far as your diet, as far as the people that you're around, if you're staying clean, little stuff like that matters. Washing your hands, Try not to be around people that have colds and flus, because if he gets the flu or cold, it escalates. They'll usually put him in the hospital because they can't control his fever. Your fever is controlled by your blood flow, and if your blood flow is not flowing properly, that means it's not fighting off the bacteria.
Right.
So it's harder for him to, to overcome a cold or flu or whatever. But advice to you until you know for sure is just, be cautious of your environment. Try to eat right. Keep yourself clean. Regular visits to the doctor. If you haven't been one that's been sick most of your life, most likely you don't have it because your body's been able to fight off stuff. If you feel that you're like sick all the time, I would suggest that you definitely check on it. We as a family don't really hinder MJ. Like, oh, don't do that because you have sickle cell. No, that's something we don't do. You know what I mean?
Yeah.
But I got to bring people aware that might be around him. Like, watch him more than I do. If he's in school or ACEs or whatever, I have to tell him.
Yeah.
And I usually say, look, I usually don't say this, but you need to know because you watch him more than I do.
Yeah.
You know what I mean? He has sickle cell. If he catches a fever, you need to let me know. If he's acting funny meaning he could be energetic one day and real tired the next. If something's going on like that, then I need to know this. The signs are apparent. If you're sick for a long period of time or you can't get over a fever or something like that, then it's time to go to the doctor.
Yeah.
You know what I mean? If you try within a day, let's say 48 hours, if your fever hasn't broke yet, like you're feeling that way, you need to go to the doctor. You need to check because your body's not being able to fight off something. Now, he's had episodes where I thought it was sickle cell crisis, but it just turned out to be, a bad cold or something, or an infection. It could be like a, what do you call it, like a viral infection. And they've just been able to give them antibiotics. And they're like, it's not a pain crisis, it's okay, let's give them this antibiotic. But then if it's not resolved within a couple of days, then they'll say, okay, you need to bring them on in because either his count is low and we need to try to get that back normal, or something like that. So say all that to say it's all about your environment. If you got people praying for you because I'm Christian, it really matters. You got people praying for you. If you believe in the Lord and know that you're healed, then I feel that that's a factor also. But on this, as earthly beings, your environment. It's your diet, vitamins, staying active, things like that. Being healthy. Trying to, what I mean? Because you won't be able to do it all the time, just because of people around you. But if you're, cognizant of that, then you'll be okay.
Okay. Thank you so much.
Oh, no problem.
Thank you.